Hi, Dr. Willis. Thank you so much for joining us this morning.
Hello. Thank you for having me.
Absolutely. Thank you for being a part of the HBCU Cares interview series. And as we discuss, we want to highlight the work that you do and also share career options and pathways and possibilities for people that are interested in behavioral health.
Mhm.
I am Christina Brantley, and I am currently at Clark Atlanta University in the School of Education. And I just started my third year in the school counseling program. So
Congratulations.
thank you. Um,
Mhm.
yes, thank you so much for agreeing to be a part of this series. So, could you tell me a little bit about you and the work that you do?
Great, thank you. So my name is Dr. Monique Willis, and I am an assistant professor at Loma Linda University, in which I serve for their marriage and family therapy program. So I serve as a director of clinical training, and so I oversee all things related to the clinical students' clinical components for their programs. And so I've been doing this. I've been in the higher education for about 6 years, and so prior to that, I taught a local CSU, Cal State University system. And before that, I actually did my internship over at Mercer University in Macon, Georgia. So I've been around a little bit, but I've been mostly in California. And I also serve as on the advisory board for the Minority Fellowship Program, which is a component of AMFT, which is our Association for Marriage and Family Therapy, for students also interested in working with minority populations in the field of family therapy.
That's incredible. So, this is right up our alley. And in our program, there are people in the clinical mental health program and some people
Mhm.
specializing in marriage and family therapy.
Perfect.
Even in our classes, we talk about it's a holistic approach because
Mhm.
everyone is a part of a family in some way.
Exactly.
What does
Mhm.
that look like? Um,
Mhm.
so, could you share how you got down this path? Because the work that you're doing seems very multifaceted. So, it's not just marriage family therapy, it's also professorship and
Mhm.
being a part of different organizations, probably serving, in different capacities of
Yes.
this space. So, could you tell us about, how you kind of got here and what that looked like for you?
Yeah. The pathway I think to getting here, I think is very nuanced for different people, right? So that my pathway was that I started as a psychology student with an emphasis in cognitive behavioral science. So I thought definitely, distinctly, I wanted to go into something that was helping people, but I thought my only pathway was going to be clinical psychology. And I think that would have been an appropriate pathway because I think that there are a lot of opportunities to serve communities of color. However, what I was looking for was missing. Like a lot of the work that I did as an undergraduate student, I recognized that there was an emphasis on just solely focusing on the individual and the challenges that they were facing. But ultimately, none of this happens in isolation. Everything happens within a family or a larger system, or within your community, or your larger culture. And so, because of that, I recognized that in order for me to make the most effective change in communities that were of importance to me, I needed something that was a bit different. So actually stumbled across marriage and family therapy. It was just by happenstance. I met a friend that was like, "Oh, I go to this school," and they were in a completely different program. They suggested try family therapy. I was like, "Family who? What is this?" And so I reached out to somebody at the campus at Loma Linda, and I found out that because I happen to be an alumni from Loma Linda as well. I did my master's and my PhD there as well. And so I happened to find out that there was this program that was specifically focused on using systemic understanding, meaning looking at systems from the larger system, from society, cultures, communities, families, neighborhoods, all those different aspects, and how those relationships serve to impact the problems that we see. So for me, that made a lot of sense because my head is very collectivist in thinking, right? Like nothing happens in isolation. We're not just seeing the problem with our friend down the street just because they have a problem. You got to think about the fact that is there access to proper school care? Is there access to proper support within the family system? Is there access to all the basic needs that people have that help them to be successful? And so this was just sort of like when I got there, it was like, aha, this is it. This is something that makes sense to the way I think about people, the way I think about problems. And so that's how I got to my journey. So I did my 4 years as an undergraduate student, and then I did 2 years as a master's student in family therapy, which makes us eligible for licensure. And then after that, I continued on with my PhD, which is about another 4 or 5 years through dissertation.
That is incredible. In a previous interview, someone mentioned that sometimes we find our calling and sometimes our calling finds us.
It finds us.
And it's very much you were on this path and trying to figure it out. And I love the way that you were just you were sure about what you believed, and then you
Hmm.
found something that could, in some way, affirm that belief, not in the way that
Hmm.
all the things you believed from it had to be true, but it
Hmm.
really did allow you to delve deeper into
Hmm.
things that mattered to you, you know? So
Hmm.
I imagine
Exactly.
that made writing a thesis or anything for your doctoral
Oh, it made made it so much easier because again, you're not just thinking about a clinical issue as a person's issue. You can think about like all the factors that help to or influence the extent to which you're seeing the kinds of challenges that you're seeing. And then you can come at it from a sort of a multifaceted approach, right? So that I can intervene with a parent or I can intervene, with a school or whatever other community resources are required to support this individual or this person that's within the system to be successful. It's all about community for me.
Absolutely. So I don't know if that would be your answer to this next question, but it is. What's the most rewarding part of your job or the work that you do?
I think I have to give you multiple answers here, and I'll tell you why. Because, namely, I get to work. So, I also am a private practice clinician. So, I have my small practice. And so, I get to work with clients directly. And I think one of the most rewarding pieces of that job has been honing in on who it is that I want to serve, right? Getting clarity about who it is I want to serve and supporting people in particular who often are caretakers of others and also serve their systems in maintaining their health and their well-being but often don't have the space for that. So I think what's been most rewarding is finding that there's a group of individuals within our world, and specifically women of color in particular, who tend to be primary caretakers of families but don't take care of themselves. And that's been most rewarding in realizing that there is a need that I can fill that I'm very, very passionate about. I think the other piece that I'm very passionate about is being able to train students who are competent and proficient in serving our communities, right? So you can't have a strong need for clinical care and not having therapists who are able to meet that need, right? And I think that there's a competency piece that's really, really critical because you can get therapists, but you don't always get good therapists. Quality therapists that understand the specificities of what people need, especially communities of color. And so for me, I've been super fortunate and super blessed to have trained students throughout their educational programs, through training, and through their associate process, getting licensure. So I think twofold. So being able to support communities directly, and then also being able to serve communities indirectly by training students proficiently has been really my blessing.
That's incredible. And I love that your students get to experience you because you are on both sides. Like sometimes people are doing
Mm,
supervision or they're getting training from someone who's removed from the space. So they may not
mhm,
understand the current issues that people are facing.
mhm,
Whereas when you
mhm.
go back and you're talking to your students, you're like, no, somebody just came to me last night. And,
Exactly.
and this is what they were
And I
going.
use those exact examples. I'm like, I just saw a client and this came up. And I think it makes it relevant. For me, it's been about how do you use as many resources as you can to make yourself most relevant in terms of the people that you're serving, the students, the clients. And for me, it's been integrating research, it's been integrating teaching, and it's been integrating clinical practices. For me, those three-prong approaches has been really, really important.
Thank you for sharing that. I think that's really important. And when people take on such a important role um, and task of teaching the future counselors or the future clinicians, you want to make sure that we're in good hands because
Mhm.
if not, how can we support those that
You
need
can't.
it most?
Yes,
Absolutely.
definitely.
So from there, what would be the polar opposite? So the rewarding part is, making sure that you have competent students who are going out into the field to do great work and also having the autonomy to choose the people that you want to serve. So with all good things, sometimes there comes something that's not so great. So what are some of the challenges that you face in the field? And I've learned in our interview in this very brief moment that it's not gonna be one thing, it's a
It might not be.
holistic approach.
Yeah, it might be, and that's because I think my brain just works that way, like, I always
Yes.
don't think about things in terms of, like, singularities. It's, "Okay, what are all the things that might be contributing to what we're seeing?" And I often ask my clients, I'm like, "What are the feelings that are coming up for you? Not just the one thing, because it's never typically one thing that we can really point to. I think the biggest issue is that there is such a huge clinical need, and there's a paucity of clinicians that are able to serve the magnitude of clients who really, really need support. I think that is probably the most challenging experience that I've had in this field, and I think the pandemic really highlighted how grave our situation is. I mean, there are such numerous grants that are available to impact and increase the workforce, and yet still there's just not enough people to meet the demand. And I think that's ultimately frustrating and heartbreaking because then people that really could exist in a way that they're functional and that could then help and support their families and their communities can't do so. So I think for me that's been the really biggest challenge is just that we just don't have enough support. We just don't have enough people, and there's just so many people in our world that are hurting. And I just think we have to be a bit more creative about how we're meeting the needs, and so that for me, that challenge may be like looking at like how is it that we support people, whether that's through peer support mentorship or through our communities or through churches, but we have to be a bit more flexible in how people get help. And also to that flexibility with being understanding that we don't have to be at our ends, in terms of our functioning, right? Like we don't have to be at our wits' end when we decide that we need help, and getting the word out that clinical support is as a resource for preventative care as well, right? We don't have to wait until we're at that point where we are, really distraught, and that's when then we need this clinical aid, but then that's when the demand becomes so short. So if we can sort of shift our mindset about clinical care and that therapy is a resource for us at all times, even when we're sort of just wanting to check in and making sure that we're okay. Or times when we're like, oh no, I'm a little stressed, or sometimes when I'm extremely like overwhelmed, like that's a resource that's available for us. So I think for us, when the magnitude of the amount of clinicians that we need is one issue that really is of concern, but then also shifting the mindset about what therapy really needs to be and that we can use it as a preventative resource is another area of concern as well.
That's so great. And it aligns so much with the work that HBCU Cares does because a large part of it is exposure. And I think when people are exploring career options and you're in elementary school, you have like a stethoscope and here's a doctor or fire truck,
Mhm,
here's a
mhm,
firefighter, and you have these tangible pieces of what this profession looks like, but no one is talking about, well, if your parent is having a bad day or if you experience something at home that
mhm,
didn't make you
mhm.
feel good, this is a person that helps you move
Yes.
through that. So, in what ways can it helps me think about, my current internship at HBCU Cares and the level of exposure that we can give
Mhm,
the people to consider
mhm,
career in behavioral health. Because to your point, if there's no one to do the work, then the healing is not going to happen in the way that it should or the way that it
mhm,
um, so thank you. That is definitely a challenge, and thank you for just bringing more light to it. Um,
mhm.
so, as our final question, what is advice that you would give to someone aspiring to be in the field of work that you're in, or just to be in the behavioral health field in general? Or you can answer both of them.
Oh, I think that's probably the best question. I think one of my learning has been through this field, it's been the need for care clinicians, care professionals to do the work of caring for themselves. And, as an educator, I recognize that while we talk about competencies and relevant skills and trainings that's required to support our clients, whether that's, cultural competency or cultural humility, right? Or spiritual competency and religious competency and how to develop and manage, clients and their clinical experience relevant to their relationship with their religion or their spirituality. We don't do great training on supporting students, trainees, associates, clinicians on how to do self care. And it's such a big topic, and people talk about it all the time. But what I did realize through this process has been a lot of burnt out therapists who don't have the capacity anymore to continue the work that they started. They came in with great hearts and like great motivation and the willingness to do all the good work, but just didn't have the stamina to do it. Well, it wasn't them, it's the system. It's a part of what wasn't provided to them, what wasn't highlighted as essential, what wasn't modeled as essential in order to do this field and do it well for a long time, right? And so I think the biggest message that I would want to share is that in exploring this need for kids, because I think innately people who tend to be care professionals or people who have a heart and want to help people, like they probably have always been that kind of person, whether they were the person that everyone wanted to talk to because they had a good listening ear, or all the family members came to. They're people who cared. But that care has potential consequences, right? Like that care can potentially have negative impacts where you become exhausted, you become depleted. And I think we got to do a better job about attending to those experiences and attending to those needs and being explicit about what boundaries do we need for our lives and what care support and what compassion do we need for ourselves in order to ensure that we are able to be able to sustain this field. And so I think that self-care, self-compassion is a big component that I would advise any person interested in this field to ensure that they have a good handle on before they pursue this industry. Because again, it's very, very rewarding. It's a beautiful thing to see a person maybe struggling with depression and then finding a space where they find the sense of happiness by connecting with their family members or friends or being able to engage in life and enjoy things again. It's beautiful. It's phenomenal. But you want to be able to do it with some longevity. You want to be able to do it with effectiveness. And when we don't care for ourselves, we don't have what it takes to be able to give what we can give to our fullest. And so if anyone can do anything as they pursue this field, it's really to make sure that they have that understanding in hand and that they develop a great structure and a great resource of community that can help support them in developing competencies in self-care and self-compassion.
Can drop the mic there. That was like I feel like it's so important. And I
It
love
is critical.
now people are also speaking about like kind of getting out of the bubble bath culture because
The
self-care.
bubble bath. What is a bubble bath? Who has a bubble bath?
Yes, yes. So like, they're fantasizing self-care
Mhm.
in a way of a manicure or, time to just take a bath. And there are things now, if that's how someone deems their self-care,
So
that's
that's
fine,
fine.
but there are just other layers that people need to unpack to make sure that they're well. And sometimes, a bubble bath just isn't gonna do
It's not it. Sometimes it's not
it.
it. Sometimes it's not it. And that's why a plan is clear, right? A plan is important because then you have the specific options that you can do that you need. So these are the kind of circumstances I'm dealing with, and this might be my go-to. And I mean, you need a toolkit, right? You need multiple options that you can pull from. Because if that bubble bath doesn't work and that, nice cup of tea doesn't work, maybe you're gonna have to distance yourself and take a nice walk, an hour walk, because you need to be able to separate from all that's going on in order for you to do your best. And so I'm in a complete agreement with you, right? That bubble bath culture needs to be popped. Like that's not always reality, and it's not always about going to get your nails done. And those things are great, not to be dismissed. But I think what's most important is really about recognizing that it's essential that we have a repertoire of resources that we can pull on to make sure that we're well. It's like that analogy. You can't get on an airplane and put someone else's mask on before you put your mask on, but we have to teach it. I think training programs need to teach people how to engage in self care and prioritize it.
Absolutely. And I think follow up to see if they're following their plans because it's easy for us to just like number 1 through 5, where are you on the scale? Are you taking care of yourself? But
Mm-hmm.
then come third year, we
There's no care. You're like, what care? Did I sleep
right.
last night? Did I eat well? Did I even drink a glass of water?
Right. Somebody check in on us. Are we okay? But Dr. Willis,
That
this is
that's the community piece, right? I think
yeah,
that is the community piece, right? That is where a self-care plan requires a community. You can't expect when we're not well for us to be able to understand, hey, that I'm picking up on the signs that I might not be well, but your community would, and they would know because you've been connecting with them periodically. You've been checking in and they could say, hey, I noticed that you haven't been, talking about doing these things. What's been going on? Oh, I haven't. I want, and so that's it. The idea, and this is why system theory just works well for my brain. You just don't function alone. And so even your care needs to be done in community.
absolutely. And it's like, although negative experiences don't happen in silos, I think positive experiences may not either. So, to your point of
Mhm,
just having a collective or community, it's very important for people on the journey to remain well. Um,
mhm.
but Dr. Willis, thank you so much for your time, for your wisdom. Just want to see if you have any last nuggets to drop before we close out this interview session.
No, I mean, I think what you are doing is wonderful. I think especially within, the Black community, bringing recognition to the multitudes of opportunities that they have that we can serve our communities, other communities as well, I think is profound. I think that, you know, what we do want to see is more of women of color, men of color in these spaces to really understand and support our communities. And so by that, I'm just really just enjoyed to be able to see and be a part of this process with you.
Thank you so much. We appreciate you and thank you for being part of the HBCU interview series.
Thank you so
I'm
much.
going to say that one more time because they're going to get on me. Okay, pause. Thank you so much for being a part of the HBCU Cares interview series.
Thank you.